To find the heart in parasternal long axis, we're going to start in the cardiac mode with a depth of about 15 to 20 centimeters. The indicator should be pointed at about 9:30 or towards the patient's right shoulder. The placement of the probe should be at the left border of the sternum around the fourth intercostal space. The patient should be supine, and if you have difficulty finding the heart, you can place the patient in the left lateral decubitus position. Start with large sweeps until the heart is in view, and then optimize using micro sweeps. You can also find the heart better sometimes if you ask the patient to exhale. Once you find the heart, you should see the prominent left ventricle, you should see the mitral valve, and then at the top of the screen, you should see the right ventricle in view. To find the heart in parasternal short axis, you're first going to start in parasternal long axis. You're then going to rotate the indicator 90 degrees, so then it's now pointed at the patient's left shoulder. You can then fan through, starting at the mid-papillary level to the mitral valve level, also called the fish mouth, up to the aortic valve level, where you can see the characteristic Mercedes-Benz view. To find the heart in the apical forward view, we're going to start with the indicator pointing towards the patient's left shoulder and just below the left nipple. The beam should be pointed towards the patient's right scapula. Often patients need to be placed into the left lateral decubitus position in order to better optimize the viewing of the heart. Once the heart is found, the left ventricle should be prominent and the septum should be vertical in the image. To view the heart in the subcostal or subxiphoid view, you're going to start by finding the xiphoid process. Locate the end of the xiphoid process and place the probe just below it. Place your hand on top of the probe and add a lot of pressure. The indicator should be pointing to the patient's left. The right side of the heart should be next to the liver.